Good morning, everyone. My name is Maya with TMC for Seniors, and this is February, and of course, it is Love Your Heart Month, and so we are kicking off our February series for Heart Talks with our pharmacists over at TMC. So I want to welcome that we have today Eric Bergstrom and Michelle Skrelowsk and Raveena Brar. So thank you for being here today.
Yeah, thanks for having us.
All right. So I know they're all gonna scatter now so that they can so that we can do the presentation. So bear with us here. We're gonna get ready to go. And Raveena is going to kick off the presentation. You may be watching us today on either our Facebook Live page or our YouTube page. Please feel free to leave any questions in the comment boxes, and we will respond to those at the end of the presentation. Thank you for being here. Welcome, Raveena.
Thank you. Thank you, Maya, for having us. As she introduced, my name is Raveena. In the room with myself, I have Michelle and Eric. And today we will be talking to you about loving your heart, knowing your conditions and medications. So to get started, just a little bit of information. So approximately 85 million American adults actually live with some form of heart disease or a disease that affects their heart. 43 million of those Americans are estimated to be at least 60 years of age or older. Heart disease, as of now and for a while now, has actually been the #1 leading cause of death in both men and women over the age of 65. And sadly and unfortunately, one person does die every 36 seconds from heart disease in the United States alone. And last but not least, February, as Maya said, is American Heart Month, and the perfect time to learn more about our heart health. So there's going to be a couple questions embedded in, and not necessarily for you to answer, but just something for you to think about as we go through the presentation. So first and foremost, what is heart disease? Well, heart disease actually encompasses a lot of different things. It's more so of an umbrella term that's used to describe a wide variety of diseases. Essentially, anything that affects our heart or our blood vessels is considered to be a heart disease. You may have also heard it being called cardiac disease or cardiovascular disease, but to be noted, they're all essentially the exact same term, just labeled differently. One of the most important things about heart disease is it's actually sometimes known as a silent killer. Reason being is its symptoms are not necessarily always present. So for example, it could be something like a headache. You may get consistent headaches. It could be fatigue. It could be a lot of different things. And we kind of sometimes can put them off as, well, maybe it's this or maybe it's that, when in reality, it could possibly be a heart disease. So it is known as a silent killer. Next question, why is heart health important? Well, before we get to why is heart health important, it's important to kind of understand how our heart works and what it's responsible for. So our heart is basically the pump of our body. Its main job is to pump blood to our entire body, which includes the rest of our organs. It helps to deliver oxygen and nutrients. So kind of think of it as it's the Amazon Prime of our body, but it also removes fluid and waste. So it does act like the garbage man as well. So what happens if our heart health deteriorates, or why may it deteriorate? There's actually a bunch of different reasons. We have the 4 most common ones listed. So our heart can sometimes pump too fast. Best way to think of this is if you wake up one morning and decide, hey, I'm going to run at full speed today. So if you do happen to run at full speed, by the end of the day, you're going to be exhausted. Same thing applies to our heart. If we're pumping too fast, it's working too hard. Now, what about if it's pumping too slow? At the same time, let's say you decide you're going to take your time doing everything today. You're going to be a lot more inefficient. As with our heart, if it's pumping too slow, it's not nearly as efficient as it should be. Pumping against resistance. So think of it as this essentially is like high blood pressure or high cholesterol. But the best analogy is you're going through a door, right? Now, let's say that door weighs 500 pounds. It's going to be a lot harder to get through that door. Pumping against resistance is very difficult for our heart. Or pumping too much fluid. Sometimes we do accumulate fluid in our bodies, and this does have an impact on our heart. Last but not least, not squeezing hard enough. So first thing that comes to mind is something like heart failure, where our heart is not able or the muscle is not as strong as it used to be, so it can't pump as efficiently. Now, with that being said, there's many different risk factors that can actually contribute to heart disease. It's not necessarily just one specific risk factor. And they're kind of divided into separate categories. So the first category are risk factors you cannot control. In here we have age, so being 65 years of age and older. Family history, let's say you have a close relative, a mom, dad, sibling, grandparent who has history of heart disease. There is actually a genetic component many times. And then gender, what we found for research is men tend to have heart disease at an earlier age than women do. But one thing I do want to focus on a little is age. So as we get older, our organs actually also age as well. So this includes our heart and blood vessels. And it's kind of to be expected, right? We're not going to be the same as we were when we were 6 months old. So what happens? In simple terms, or I guess not so simple terms, our heart's electrical system can have irregular beats. What happens is your heart has a conduction system, and it's beating and it's sending signals, but sometimes as we age, this conduction system can become tired. And what happens is the blood is no longer pumping how it used to be. And if this happens, it can lead to blood clots forming in our body. Fatty deposits can also build up in our blood vessels, which can lead to reduced blood flow. What I think of this is something like high cholesterol. So if we have a bunch of cholesterol in our body, it's now going to start to stick to our arteries. Unfortunately, it's not just the cholesterol that's sticking. There's a lot of other things in our blood as well. Platelets, blood cells, etc. So someone once told me, actually not too long ago, that the best way to think of it is, it's not just like a piece of gum. It's a piece of gum with Skittles and popcorn and a bunch of other things kind of lodged together. So that's what a fatty deposit would be. Next, we have parts of our heart and vessels that may become more stiff. So as we age, we're not as flexible. Same kind of goes for our vessels. This can lead to increased pressure and resistance, so it's kind of harder for the blood to get through. Now the risk factors we can control. So starting at the top, we have being overweight, lack of exercise, stress, smoking, high blood pressure, high cholesterol, and high blood glucose. We'll get a little bit into these in a little bit, but the two I do want to focus on are going to be high blood pressure and high cholesterol. So as you'll see on the left, we have a normal, healthy artery. You see the blood flowing, it's thriving, it's living its best life, if you will. In the middle, we have high blood pressure. You'll start to note that the artery is starting to kind of degrade a little. It's having some, on the ending, or I guess on the sides of the artery, I guess best way to put it, the blood pressure is so high that it's starting to cause a little bit of damage. Then on the far right, we have high cholesterol. And this is where we have damaged walls due to the plaque buildup, as well as possibly blood pressure. So you can kind of see the progression of a normal artery versus high blood pressure versus high cholesterol, and kind of see kind of makes sense of if we have high blood pressure or we have high cholesterol, why it may be more difficult on our bodies and why we may end up having things like heart disease. Couple things to note, high blood pressure and high cholesterol can actually have many effects on your body. I know I'm talking about just heart health, but there's a lot of different things that can have an impact on. And I know it's a lot of information, but I'll try and simplify it. First thing, starting from the top of our heads, are stroke. If we have high cholesterol, high blood pressure, it can actually cause stroke. Our blood vessels become more damaged, which can cause them to burst. Now, another thing to note is if we have high cholesterol, those plaque buildups we kind of went over a slide or two ago, they can actually dislodge from where they're sitting in our arteries, make their way to our brain, and we can have a stroke that way as well. Loss of vision. What happens is if your blood pressure is increased, those optic nerves, meaning the nerves in our eyes, they're being hit with a lot of pressure. If you are constantly hitting something with a lot of pressure, you may have nerve damage, so we can have a loss of vision. Then we have kidney and or liver disease. And what can happen is if our blood pressure, high cholesterol, things are kind of just not where they should be, our kidneys can become damaged. They can become clogged, and they may no longer be able to filter the blood how they are intended to work. Same goes for our liver. If we have a lot of components now sitting in our blood, the liver has to work overtime to detox. And then as we've kind of been talking about, heart and lung disease. Heart and lungs can become overworked. And what happens is you may notice there's a increased risk, or you actually have increased heart pain, increased risk of heart attack, shortness of breath, and sometimes even heart failure. And lastly, sexual problems, which is caused by narrowing of the vessels. And this can lead to conditions like erectile dysfunction and decreased libido. So now the million-dollar question, how to take control over your heart disease. Heart disease may not always be reversible per se, but there's a lot of things that we can do to help get it under control. So starting at the bottom, it's just going to be healthy eating. Want to make sure that we are eating healthy. Get your fruits and veggies in, low sodium, so low salt. You also, want to make sure if you're using a salt replacement, make sure it's okay with your doctor. But overall, eating healthy. No smoking. As we went over a few slides ago, smoking can have a big impact on our heart health as well as the rest of our body. I'm sure we've all seen those pictures of the before, after heart and lungs. So it's something to think about. It's important to, no smoking. Healthy weight. Healthy weight kind of goes in conjunction with the healthy eating and physical activity. You want to make sure that you are seeing your physician and there is a plan in place if there needs to be, which kind of leads us to regular physical activity. It's important to get those steps in, 30 minutes at least, 3 to 5 times a week. I understand with quarantine, things are a little more difficult, but sometimes that means just walking around the living room. Get those steps in any way you can. And then we have treating high blood pressure, controlling diabetes or high blood sugar, and then maintaining healthy cholesterol levels. So these 3 things, it's very important. They're kind of in conjunction to work with your doctor. You want to make sure everything is controlled. And lastly, we have taking heart protective medications as prescribed. So a couple things to note. You want to be able to always answer the following questions in regards to your medications. So whether it's your heart medication or any other medication, just as a disclaimer, I do want to make sure you're getting through these questions and you're fully comfortable with them, because at the end of the day, you are putting a medication into your body. So it's important to know how it works. So first thing is, why are you taking this medication? If it's a heart medication, what is it for? It's important to understand that. How do you take this medication? Is there a specific time of the day? Should you take it with food? Should you take it without food? What are the side effects of this medication? This is very important to note. A lot of times, medications on our heart can lower our blood pressure. So when we get up very quickly, we may feel a little more dizzy, or things of that nature. So you want to make sure you're aware of the side effects. Do you need to monitor anything? This applies to both yourself and the physician. Are you going in for labs, or should you be going in for labs? Or is there something at home you should be looking out for? Are there any drug interactions? This is specifically important if you take any supplements, or is anything interacting? And lastly, are there any food interactions, which is very important because there are certain medications where what we're eating can have an effect on them. And as always, please talk to your doctor or pharmacist before starting or stopping any medications. And now I'll pass it on to Michelle, who will go over the medication portion.
Hi there, everyone. Just as a reminder, my name is Michelle, and today I'm going to be focusing specifically on the medications that we take to treat the variety of heart disease. It should be noted that these medications may not always cause notable changes, like Raveena had mentioned. Sometimes you do feel dizzy when your blood pressure is a little lower, but you don't necessarily feel that unless you get the side effect of being dizzy. So you're not always able to feel that you have a lower blood pressure. This can actually help you. These medications can actually help protect you from worsening heart conditions like heart attacks or heart failure. So I'm going to cover a variety of medications, which are going to include anticoagulants, antiplatelets, anti-anginals, blood pressure lowering medications, diuretics, cholesterol, and rate controlling medications. So first we have our anticoagulants. These are what we commonly think of as our blood thinners, and they're most commonly used for atrial fibrillation, which is kind of when your heart beats a little, the electrical conduction in your heart is a little off, so the top part of your heart is beating a little faster than the bottom part. Because this occurs, you're more likely to get blood clots, and when those blood clots go to other parts of your body, as Raveena had mentioned earlier, can actually cause bad consequences. The medications decrease your chance of forming a clot, but they do not actually break down clots that are already formed. A couple of medications that we commonly see include Ixaban, known as Eliquis, dabigatran, known as Pradaxa, rivaroxaban, known as Xarelto, or warfarin, known as Coumadin. Some side effects that we commonly see with this class of medications is bleeding. This can be found in the urine or the stool, but it's also important to mention that not all bleeding is bad. Because this side effect of bleeding can be very good or bad, it's important to know what's good. I guess good in the sense of bleeding, as in if your gums bleed a little more, that wouldn't require a trip to the doctors. However, if you have a bloody nose that keeps bleeding after 15 or 20 minutes, that requires a trip to the doctors. These medications, if they're not working, on the other hand, can actually have more symptoms of things such as blood clots, which can include having shortness of breath or swelling in different parts of the body. The next class of medications include the antiplatelets. These stop platelets from activating in our blood to stick together. These help prevent clots in that way. They're commonly needed after heart attacks as well as after stents. These class of medications include aspirin, clopidogrel, known as Plavix, ticagrelor, known as Brilinta, or Prasugrel, known as Effient. We do sometimes see a combination of these together, so a patient can be on aspirin plus clopidogrel or aspirin plus ticagrelor, but we don't generally see any of the three mixed together. The bottom three mixed together is generally aspirin with one of them. This is called dual antiplatelet therapy, and some of the common side effects that we do see, and as they also help prevent clots as the previous group of the anticoagulants, these one also have a side effect of bleeding. This can also be the nosebleeds or urine, blood in the urine or stools. They can also cause bruising, like the other class can. However, it's also dependent on how bad you're bruising when you need to go see your doctor about it. Some less common side effects with this class of medications include nausea and headaches. Our next class of medication is our anti-anginal medications. These medications are the kind of fast onset that immediately open your blood vessels to allow more oxygen to get to where it needs to go. This can help specifically with heart pain and or chest pain, and the specific medications that we see in these class are known as nitrates. So there's nitroglycerin. In other disease states, we also see isosorbide or nitroprusside. So there are some specific recommendations with nitroglycerin. With this medication, you always want to be sitting down because since it opens your blood vessels immediately, you are at a very high risk of getting very dizzy and falling. This is a medication to keep with you at all times, but it is also necessary to not keep it in places that's not on you. So for example, you don't want to keep it in your car because here in Arizona, it gets very warm, and that can actually break down the medication, and then the medication might not be as effective when you need it. So it's important to keep it with you, but not in places that can actually cause it more harm. And how we take this is we place one tablet under the tongue at the sign of chest pain, usually specifically when it's in regards to not having enough oxygen getting to our heart, is that kind of chest pain known as angina. One tablet can be used every 5 minutes for up to 15 minutes, meaning that you can only use a total of 3 tablets in that 15 minutes. It is recommended to call 911 if your symptoms do not improve after 5 minutes, so after your first dose. The next class of medications that I'll be covering, the side effects of this class of medication most commonly is headache and dizziness, but these are both signs that the medication is working, so it's something that is expected. Next class of medications will be our blood pressure lowering medications. These expand the blood vessels to make it easier for blood to flow throughout the body. This means that the heart does not have to work as hard to push blood around the body. As Raveena had referred to in her diagram, it was easy to see that in that middle photo. Blood was having a harder time flowing through the vessel, and these medications actually help it be a little easier. There's a couple of classes. We have what we know as our ACEs. These are the medications that end in pril, so things such as lisinopril or benzapril. Then we have our ARBs. These are medications that end in sartan, so things such as losartan or valsartan. And then we have our CCPs, which are our calcium channel blockers, and these end in penes, such as amlodipine. Commonly, we see a lot of these medications be used together. However, there are two certain classes of medications that should not be used together. Those are the ACEs and the ARBs. We don't use these two medications together because they pretty much work the same, and it wouldn't be very beneficial, and it could actually be a little harmful. Some side effects that we see, it is a little dependent on which medication or which class of medications you're taking. We do see dizziness with all of the medications because, as we spoke about a little earlier, these medications lower your blood pressure. When your blood pressure is lower, it can cause a little bit of dizziness. With our ACE inhibitors, so our lisinopril, a side effect that can be seen is a cough, which, when this occurs, warrants a talk with your doctor. Next, with also our ACEs, which is more of an emergency situation, would be if there's any facial swelling or throat swelling. High potassium levels can occur with either our ACEs and or our ARBs, so our lisinopril or our losartan. And then with our calcium channel blockers, we can see constipation, headache, and leg swelling. Next is our diuretics. These also lower blood pressure, but are in a little bit of a different class than the previous blood pressure lowering medications that we spoke of. These help the body get rid of water and sodium through urination. These class of medications also help the heart to not have to work as hard to push blood around the body. So we have three classes of the diuretics that are commonly used. We have the loops, and this is known as furosemide or Lasix. We have our thiazides, known as like a specific example of that class is the hydrochlorothiazide, also known as HCTZ, or potassium-sparing potassium-sparing diuretics. This is our class of medications. Since our body does get rid of water and sodium, it also can deplete some of our electrolytes. In patients who have a bigger concern for having potassium be removed from our body, the potassium-sparing diuretics are actually pretty helpful as they help the body retain that potassium. So some side effects of this class of medication do include urination, which is something that we expect. However, if there's too much urination, it can lead to dehydration. Also, as I mentioned, we can have those electrolyte imbalances, which can include sodium, potassium, magnesium, calcium. This can sometimes require supplementations or switching to a different class of loop diuretics. Dizziness, as mentioned with the others, as it can lower blood pressure. This class also does show some sun sensitivity and rash, so it's generally recommended to either have a hat on or stay out of the sun or apply some extra sunscreen when going out. And these classes can also cause some kidney stones. Our next class of medications, as Raveena talked about, are the ones that lower our plaque buildup in our body, resulting from cholesterol. So they focus specifically on lowering LDL and triglycerides, which are our bad cholesterols, And then we want to raise our HDL, which is what this medication also helps to do, which is the good kind of cholesterol that we want more of in our body. These medications can decrease our risk for heart disease and strokes, but they're actually commonly used after heart attacks to prevent another heart attack from occurring. Another cool fact about this class of medications is they can actually reduce inflammation as well. This picture does a good job of showing how the plaque buildup. On the left-hand side, you can see that normal pressure, blood is able to flow very easy. And as more plaque builds up, it becomes harder for blood to flow. So specifically in this class of medications, one of the most common group of medications are the medications that end in statin. So this includes our atorvastatin, known as Lipitor, our rosuvastatin, known as Crestor, or simvastatin, known as Zocor. However, there are other medications that can help with lowering cholesterol, which can include your fenofibrates, niacin, and omega-3s. Some side effects with this class that we commonly see, well, not necessarily commonly, but that does occur in people can include muscle pain, digestive issues, as well as dizziness too. Last, we have our rate controlling group of medications. These slow the heart rate by decreasing the electrical conduction, helping the heart rest. They're commonly used after heart attacks and in those who have high fast heart rates, and can actually help patients with heart failure. So for example, in a patient whose heart rate is about 130 and they're just sitting and being calm, we generally would like our patients who are not working out or exercising to be between 60 and 100. So a patient who is at 130 beats per minute means that this patient has about 200,000 extra beats in a day, which means that your heart's working a lot harder than it should be to get blood to go around the body. So these medications are pretty good at helping slow your heart down to help decrease your risks for the heart, like other types of heart diseases. They can also decrease your blood pressure. So it's one of the classes of medications that can be added to a blood pressure lowering or a diuretic. These commonly end in LOL. So during texting, it can help you remind to not say laugh out loud. But these include Metoprolol, also known as Lopressor, Toprol XL, Propranolol, known as Inderol, or Carvedilol, also known as Coreg. Some side effects of these medications, as I mentioned, it does lower your blood pressure too, so it can make you a little dizzy. It can slow your heart rate, which in some cases is what we want. In other people, it might slow it down a little bit too much, so it might not be the right medication for you. It can cause some exercise intolerance and some shortness of breath. And this is probably the one class of medications that you never just want to stop. You always want to talk to your provider prior to stopping it. There are a variety of herbals, as you can see on this screen, that may help with hypertension. This can include basil, parsley, celery seeds, etc. But overall evidence for herbal supplements is lacking, and many times they may interact with your other medications. So these medications are not regulated by the FDA. And these are some of the herbals that may help with cholesterol. So for example, garlic, fiber, red yeast, rice. But this also has the potential to interact with your other medications, and these ones are also not regulated by the FDA. So in summary, heart disease is the #1 leading cause of death in men and women over the age of 65. It is known as the silent killer. It is important to take control of our heart disease and incorporate more healthy habits into your daily routine. Medications can help prevent heart conditions or help slow the progression to certain heart conditions. That's why it's very important for us to know all that we can about our heart medications. For example, as Raveena had mentioned earlier, it is important for us to be able to answer each of the questions that she had mentioned. Lastly, always talk to your doctor or pharmacist before stopping or starting any medication. Thank you. Is there any questions?
So thank you so much, Michelle. I appreciate all that information. There was a ton of information in there all about a variety of medications. I did have a question that came up about the herbal supplements that you mentioned at the end there. What should somebody look for when they are wanting to buy an herbal supplement? Because we know that there's just so many out there. What is good for somebody to be really looking for, though?
We're actually going to have Eric answer that one.
All right, so I'm Eric Bergstrom. Take off all my PPE for this. So there is a symbol. It's called Usp Verified. Usp is like United States Pharmacopoeia. They have a symbol they put on medications that they assess for accuracy and dissolvability. Like it actually kind of crunches up in your stomach when you take it and doesn't stay intact. So they do make sure that it's kind of the Better Business Bureau of medications, where they do validate that what's in there is supposed to be in there. So herbal supplements sometimes do not have these. Herbal supplements are some things that they take like leaves and they grind them up and they put them into substances. So these leaves are all from the same plant. Let's see, I'm trying to get it all in there. But I would say they're not all the same. You know, one of them's nice and green and looks very healthy. The next leaf is kind of like maybe going through some changes, maybe bugs. I don't know what else is like affected that leaf, but it's turning more yellow. And then this leaf is like brown and ready to like fall off. So I can tell you when you take an herbal supplement, it's like taking echinacea, eucalyptus, whatever, but you don't always know what you're getting because the substances that are in here are not defined what's in there. So what we're doing when we take medications is we take metoprolol. That is just one substance. This might have, you know, again, it might have 100 different substances in this product, and you don't know which one is going to actually work for you. So we really recommend not using herbal supplements and using the ones that we can control.
Great. So I was going to ask you, should you ever take an herbal supplement along with all those other medications, or make sure your doctor is fully aware ahead of time? Correct?
Definitely. Before you take anything like that, you research on the internet, you can talk to your friends, but really you need to talk to your pharmacist and your provider before you start anything new, because there's interactions that maybe are not known, and there's some interactions that are known, because if people are on blood thinners and they take ginger, ginseng, ginkgo, things like that, they can start bleeding more. And so now they're going to end up in the hospital with a bleed. So we really want to make sure that, you know, and one of the things that interaction checkers do not do at pharmacies is check these, because these do not get entered into the system. And so, you know, when you ask a pharmacist, you know, is there any interactions between medications, they can only tell you what's in their system. So if you get prescriptions filled from mail order or from a different pharmacy, that might not be checked either. So really having all your medications at the one place, or having somebody know all your medications that can review to make sure there's no interactions, duplication, side effects that you're getting.
So would you recommend some sort of a med reconciliation? How often, just as you change medications to ensure that maybe you're not having any additional interactions with maybe a new medication that's been prescribed when you go to your pharmacy, or how pharmacies are willing to reconcile with you? I know you have done a great job. We've had you here before, where folks have been able to come in and bring their bag of all their medications. So if they go to their pharmacy, would they be able to do that there too, Eric?
Yeah, definitely. Like, stores can be really busy. So I think too, it's like bringing a list of all your medications to the store of things that you take. Some stores can provide a list, a printout list of everything you get filled there. So you can bring that with you to other places. I think your physician too, like bringing all the medications that you take with there. So, you know, finding time to sit with a pharmacist and talk about medications, especially with vaccines. I mean, I think that pulls a lot of the pharmacists right now, probably, if they're starting to like do more vaccinations, especially just with flu alone. They're usually busier this time of year now with the COVID vaccines. But I would say definitely anytime you start a new medication, you should bring it up again. I'd say yearly definitely is something, because as Raveena said, as we get older, our organs all change, and they don't usually get better. They usually start declining, just like you buy a car and it starts, like, things start going wrong the longer you have it. So maybe because of your organs, your doses need to be adjusted. Maybe things that you're on should be like tapered off. Sometimes even when you get stents, Michelle mentioned like dual antiplatelet therapies when you're on aspirin and Plavix. But sometimes after a while, you might want to just stop the Plavix or Brilinta and just stay on the aspirin. And so again, it's those kind of questions that pharmacists and doctors can ask when you're on these medications, like how long have you been on it? And like both of them said, like, know your medications. Why are you on it? Because a lot of people just like say, oh, I take it for my heart. And as you can tell, there's a lot of parts to your heart that you just can't, like, you could take something for atrial fibrillation, but that might help your blood pressure too. But it's really important that you know, like, why you take your medications and everything you can about it. So, and that's why you're tuning in today. So we hope that we can help you understand a little bit more about your medications.
Yes, so there is certainly no shortage of medications when it comes to your heart. So it was a great breakdown of the different types of medications. So we appreciate all of that. So I think that's all the questions I have for today. I want to thank you all for being here. We do have a presentation tomorrow that we'll be doing at 10 a.m. as well. If you are interested in joining us, it is on cardiovascular disease, fact versus fiction, and it will be with Dr. Gordon Watson of Pima Heart and Vascular. So please join us then. And thank you all for being here, and we'll see you at our next presentation.
Thank you all so much, and thank you, Raveena and Michelle.